now, according to the clinical and subclinical coccidiosis, and customers asking to diagnose the coccidia. Now, how we can diagnostic first, and what is the best lab diagnostics technique we can use to differentiate between these subclinical or clinical?
Well, it's a really difficult question, and maybe it will take some time to answer. I think, first of all, we need to differentiate subclinical and clinical coccidiosis. In clinical coccidiosis, you have some clinical signs, so you can suspect there is a problem. So in that case, if you have a suspicion, you will bring some birds, representative birds of the flock, to the laboratory. And in that case, when you suspect a real problem that is occurring, lesion scoring is the best way. I think it's the only way to make a relevant diagnosis. So lesion scoring is based on the description of Johnson and Reed in 1970, and they described a scoring scale for the 5 species that cause some typical lesions. And within this scoring scale, that goes from 0 to 4, if you have 0, 1, or 2, depending on the species, you may consider that coccidia are not responsible for the clinical signs. But if you see in some species lesion score of 2 or 3 or 4, then if you have some problems in the flock, you may make a relationship between what you observe in the flock and the lesions. So the coccidia are only or partly responsible of the problem. So in that case, we need to have a treatment or something to try to improve the status of the flock. So I think in case of clinical coccidiosis, the best tool, the only tool, is lesion scoring. In case of subclinical coccidiosis, there is nothing really that we can do, because in case of subclinical coccidiosis, we don't know when it occurs, because the birds won't get sick. So we don't know where they get infected. And as the lesion will last only for 3 to 4 days, if we bring some birds for routine control to the laboratory, most of the time they won't find any lesions. And in case of subclinical coccidiosis, you will see only the consequences. It means heterogeneity of the flock because of the small birds that had a reduced growth, and you don't see the increase in feed conversion ratio during the growth of the birds. So subclinical coccidiosis, unfortunately, you cannot suspect when it occurs. You only see the consequences, and there is no laboratory technique in order to detect subclinical ones. But in laboratories, sorry.
No, this is my question. If there is any technique on the laboratory can help us to diagnose the coccidia.
In case of subclinical coccidiosis, if you bring some birds to the laboratory without clinical signs, but you suspect maybe subclinical coccidiosis, if the laboratory looks for the typical lesions, if he finds some lesions, okay, lesion score 2, it means that it will have an impact on growth. So you can have to do something against the coccidia. But some laboratories won't use the lesion scoring. Some of them will use the amount of oocysts inside the droppings, or they make some scrapings in the gut in order to look for, under the microscope, developmental stages of the parasites. But in that case, we must all remember that coccidia can develop without negative effect. So we can have only carriage of this parasite. So if we find parasites, if we find coccidia, even in the droppings or in the guts when we make some mucosal scrapings, it doesn't mean that coccidia have a negative effect on the birds. Maybe they are there, but they have no impact. So OPG, oocysts per gram, the oocyst numeration in the droppings or the mucosal scrapings, they only give us some information that parasites are there. So as parasites are there, there is a risk, but risk is not synonym of a problem. So with subclinical coccidiosis, there is no typical laboratory method to make sure it is subclinical.